We had this patient come into our emergency room after having shortness of breath. He also had the early signs of a stroke.
We had to intubate him right away. It turned out that he had been having flu-like symptoms for the past week. He had weakness on one side of his body and had neurological symptoms. And at that point, we realized that we were dealing with COVID plus.
Certain people who have COVID can develop a disorder with the blood, whereas their blood is more prone to clotting.
Not only did he have a blood clot in his lungs, but he also had a stroke, so a blood clot into one of the arteries and veins in his brain.
And he was rapidly declining and going to die.
This was the scariest case that I've seen, just because he was younger than me.
So when someone's lungs are not working, we put them on this machine that basically takes the blood out of the veins, puts it through a machine that then oxygenates the blood and then puts it back into the patient. Basically an artificial lung. Dr. Promoriters called me, and then we activated a team to go to LIJ and put the patient on ECMO.
And as soon as we turned on the machine, his oxygen saturation went from 20–30% to 100%.
We knew that he had a long course ahead of him, but he had a chance.
The patient was then transferred to LIJ immediately.
Once he got to LIJ, he spent over 30 days on ECMO. Normally, our ECMO time is somewhere 7 or 8 days. There were a lot of times where we weren't sure how Mr. Velasquez was going to do and if he was going to pull through this or not. It was just day-to-day meticulous hard work to just keep him alive.
They never gave up on him, and he started to do better. He turned around. And when they called me to tell me about his survival, we said, this is a guy who we can get better. We designed these units to be able to move these patients, the survivors of COVID, out of the ICU into these units and provide all the wraparound services that they needed. And that's exactly what the story of Tito is.
He arrived completely paralyzed on his left side, unable to move any of his extremities and unable to walk and participate and barely even communicate. And the day he left, he was walking, he was talking, and smiling and laughing.
It's just the rehab people, it was the nurses, the respiratory therapists doing a tremendous job of getting him off the ventilator, trusting us and getting him comfortable to breathe on his own.
Congratulations, Tito! Tito!
What they did for him in that rehab period also was amazing and will change his life forever.
When I saw him stand up and walk down the hallway, it's really one of just those moments of your career where you say, this is why I wanted to be here, this is why I wanted to help people.
Whenever I think of him, I think to myself that this is the reason I was deployed all these weeks, that I was meant to be here at that time to help him live.
Yo le doy gracias a Dios que a las manos que he caído, no, buenas manos.
And it was tears of love and joy and happiness that he was able to get as far as he did, and knowing that we can get him all the way to home.